Tips to help you get the pharmacy residency program you want.
Hello, and welcome to the PharmEZ Tutor channel. My name is Ken Eto, and today I'll be giving you some tips to help you get the pharmacy residency program you want. Now, there's no doubt that applying to a pharmacy residency program is very stressful. Not only does it come at an important time when you are going through your clinical rotations at school, but getting a residency is key to charting the course of your future pharmacy career. In March of 2020, the ASHP Resident Matching Program announced that 3,904 applicants out of 6,185 participants matched to PGY1 residencies. This calculates out to an applicant match rate of 63%, which means 2 out of 3 of you will get a residency program. There's hope there. You can look to see how well your pharmacy school did on matching their students by clicking on the link I provided down below in the description and comments section for this video. When you begin preparing to apply to your pharmacy residency program, you'll probably first visit the ASHP website and study all the basic requirements and deadlines. You will fill out complicated paperwork that is required, such as your CV, letter of intent, and requests for letters of recommendation, and then apply on forecasts. But what happens after all this process is completed? You will then begin to prepare for your interview. Now it's time to prepare for the all-important interview. My focus today will be to give you 4 important tips to help you prepare for your residency interviews. To prepare for the interview, I would assume that your first inclination will be to perform a Google search on pharmacy residency programs. This is when you'll generally find a multitude of sites that will offer list upon list of potential interview questions. You can try answering them one by one until you get to the 250th question. But is this the right way to go about preparing? Each question can be a challenge to answer if you haven't properly prepared for them. Now you feel yourself overwhelmed and confused. You ask yourself, how do I get through all of this without getting so mixed up? Well, there's a better way. The answer is you need to take an organized approach to the interview. This means placing your thoughts into categories for easier retention and retrieval. Organizing your thoughts into groups is the key to staying calm and giving the best answers during the stressful interview.
So how can you accomplish this? I'll try to simplify the steps that I would recommend to proceed with. I'll cover 4 helpful tips that you can use. Tip number 1, Socrates, know thyself.
Socrates, the most famous of the ancient Greek philosophers, was once quoted as saying, "Know thyself." This is the first step on the road to getting your residency program, because if you don't know yourself well enough, then you will have difficulty in answering the questions during the interview. The interview by itself is stressful enough. What will help you get through the interview is thoroughly knowing yourself ahead of time. What's the easiest way to get to know thyself? Do a complete evaluation of yourself. Think back on real-world events that happen in your family and social life, at school and organizations, and in your past jobs. Retrieve your successes and accomplishments, and yes, even your failures. Draw from your own personal experiences from the past. Include times when things went well and you celebrated, and when times things didn't go so well and you use this as a learning opportunity to better yourself. Why do we want to know your past personal experiences? Because a true life experience that you went through is easier for you to remember, and thus it will be easier for you to say during the interview. It comes out smoother because you are familiar with it and you believe in what you are saying. These are situations that really happened to you that you can use as examples of stories to tell. There's no need to get stuck on answering since there are tons of examples from your past. You just need to fish them out from your past experiences.
It really is a story to tell. Interviewers enjoy listening to these stories since they tell a lot about the person rather than memorized one-liners. Some interviewers may even remember a candidate who had a very interesting story to tell that sticks with them long after the interview is completed. They may even tag the person with that memory, which is a good thing when you have so many candidates vying for limited spots. While getting to know thyself, be patient and try to be as complete as possible with the details. Collect and gather these experiences and begin organizing them into categories. Here are some suggestions to think about. Think back on your clinical rotations and remember the top examples of the good and bad things that happened. In the table, I listed some questions to help you along. The material in the table is too long to cover line by line in this video, so please return to this slide later on to go over them. Basically, think of examples of how you help patient care on your rotations and how this made you become a better clinician. Transform these examples into brief stories to relate to the interviewer. Do this as well for your personal life experiences, including knowing your strengths and weaknesses and being able to accurately describe your personality. Work experience, both pharmacy and non-pharmacy, is very important for the interviewer to cover because it shows how the candidate functions on the job in practical situations. It also tells the interviewer how well the candidate functions with coworkers on a team, how they relate to their supervisor, and how well they provide customer service to patients, nurses, and doctors. There should be a wealth of stories to tell that describes how you handled situations that occurred at work. Include those that were especially stressful, where you had a conflict with someone else, and maybe one where you made an error and learned something from it. Leadership in organizations is another key area that interviewers will pay close attention to. Tip number 2, apply the self-knowledge grid.
Now we need to expand and add the missing pieces to complete knowing thyself. Let's take a look at the self-knowledge grid.
There are 9 categories in the self-knowledge grid that most general questions will fall under. Take a moment and pause the video to review each category. If you are able to describe yourself in reference to each of these boxes, then you have done a good job evaluating yourself. We need to complete this grid, so let's take a look at some of the other elements that we did not ask about before. Many students apply for residencies, but they never really fully understand why they want to do one. Make sure to come up with 2 or 3 clear reasons. And tailor-make your answers on why you have selected the institution you are applying to. What is so special about their site that you gravitated to them? Many students also do not have a clear vision of their future goals. While it's difficult to predict, it is expected that the candidate knows in what direction they are going and what they will pursue. The applicant should also have a good insight into the changing healthcare landscape and how they will need to adapt and diversify in order to meet these changes in job responsibilities. You don't need to have been a president of an organization to own leadership qualities. Leadership comes from within. If you are a person who takes responsibility for your actions, shows command and decisiveness with making sound decisions, and who engages in teamwork, then you are a leader. Think back on particular examples in your past that showed your leadership qualities. If you can think of examples that reflect this definition, then you will do fine with this category. Other characteristics to find examples for would be for those that reflect your teamwork, time management, adaptability, and openness to change. Tip number 3, preparation.
Preparation, preparation, preparation. This is a vital step. Prepare, practice, and refine your answers to potential interview questions. The name of the game is careful and thorough practice. Make sure to practice by answering out loud. Maybe use flashcards. Ask friends to join in and help out. Now get the sample questions that you've collected from the internet and practice. Apply each example question to the appropriate grid category and see how well you've done with your preparation.
Quite often, interviewers are looking more at how you answer the question, not what you answer. Some questions may not even really have a true answer, but they look at the thought process that you use to work out to get the answer. So if it's something that you don't know, maybe say where you would look up the information to find out more about it. And please make sure not to mention the internet or Micromedics Lexicomp as your #1 drug reference source. A better answer would be the literature or a respected textbook. Tip number 4, hot topics.
Study up on some of the hot topics. What are hot topics? They are current pharmacy topics that are being discussed. Obviously, it's very important to stay up to date with any drug or biologic used in the treatment of COVID-19, including remdesivir, bamlanivimab, baricitinib, casirivimab, imdevimab, and the vaccines.
But don't forget to study up on other important pharmacy-related discussion points that have been obscured by the emphasis on coronavirus treatments. These include the recently published IDSA guidelines on vancomycin with an emphasis on Bayesian dosing, newly approved antibiotics for multi-drug resistant organisms, DOACs, how to prevent ADRs and which reversal agents should be used, cardioprotection by diabetic drugs, GLP-1 receptor agonists, and oral SGLT2 inhibitors. Future roles for pharmacists, both hospital and outpatient. Biosimilars, advantages and disadvantages. And the impact of Amazon Pharmacy prescription delivery on retail pharmacy. Students are often worried about which clinical questions will be asked during the interview. And since virtually anything can be asked, this topic is beyond the scope of this lecture. However, it's a good idea to focus in to study common disease states such as heart failure, diabetes, community-acquired pneumonia, sepsis, electrolytes, and kinetic dosing. Questions from these areas will always come up.
Here are some general reminders for during the interview. Keep your answers short and to the point. Do not ramble and do not digress. Be articulate. Don't mumble. Stay positive. Sound excited and interested about everything you experienced. Be proud and upbeat of your accomplishments, and let them know that you stand out. Interviewers hate boring, undermotivated candidates who act disinterested. Make sure you show enthusiasm. Never bring up a bad experience on rotation or badmouth a preceptor. Stay away from these downers that can get you in trouble. Make sure you review all of your presentations as they are fair game for questions. In fact, anything on your CV is fair game for a question, so pay close attention to all of the content. Include posters and the research behind it, and create a concise summary of the results and conclusion of the study.
Questions for them. Try to come up with 3 or 4 good questions to ask them. Make sure to avoid the standard questions and things you should already know. Some good questions might be, how flexible is the residency curriculum as far as elective experiences? Where are your recent resident graduates working at? A bad one would be, how large is this hospital in terms of number of beds? Know most of the facts about the hospital and residency ahead of time and formulate questions off of this. For instance, I know you have a large NICU here. How involved are the pharmacists in the care of these babies, and what opportunities are available for residents? Or, what are some of the projects the residents are currently working on?
What are residency program directors looking for? It's going to be vastly different for each program, so I can't give you too much specific advice here. However, I can tell you the 3 important factors that stand out in my mind. Number 1, fit. The candidate's overall character, skills, and goals must match the institution's pharmacy culture. Number 2, willingness to go the extra mile to learn and to do well. has enthusiasm with an energetic go-getter attitude. And number 3, aptitude and good knowledge, a good database and good problem-solving skills with common sense. Others I would place as important characteristics would be work experience, grade point average, and being detail-oriented.
Here are some other factors that residency sites will consider as important. Please pause the video and take a minute to review them. Networking. It goes without saying that it's extremely valuable if you have a good networking system of pharmacists and residents who have recently gone through the interview process at the institution that you're applying at. Ask them if they would be willing to pass on some helpful advice to you. You'll find that most people will be very accommodating. Video conferencing interviews in the COVID era. Here are some reminders regarding your audio visuals. Camera position. Make sure to position the webcam on the computer so it is at eye level, about 2/3 of the way up to the top of the screen. Put it right at eye level so you're not looking up or down. Light source. Ensure that there's a good light source in front of you, not behind you, and that your face is well lit. Experiment with lamps and with the ambient window lighting. Background. Create an uncluttered background. This shows you pay attention to detail. Use props to make your background interesting. And finally, make sure to dress professionally. When you're doing video interviews, it's very important to look straight into the camera as much as possible. Looking at the camera is as close as you can get to making eye contact with the interviewer. When you're talking, look into the camera instead of looking at yourself talking on the computer screen. The other side will feel like you're 100% engaged. You should not look at the picture of the other person on the screen. Looking at the screen will appear to others on the call like you're gazing off into space. This may not feel natural, and it will take some practice to get used to. It goes without saying to test your equipment before the video interview to make sure it works. If you don't have experience with video conferencing, find a friend, colleague, or group who you can practice with. Before the interview, have a friend help you perform the video conferencing equipment checks to make sure they properly operate. The microphone, the wired earphones or earbuds, and lighting. Depending on which site the institution uses, make sure you know how to log into Zoom, Microsoft Teams, Skype, WebEx, or others. Here's a hint. Use Post-its. Remember that the interviewer can't see your interview space, so use this to your advantage. Place notes or questions directly onto the computer screen using Post-it notes, or on the wall behind your camera. The interviewer on the other side won't be able to see these cheat sheets. You started off wanting to do a pharmacy residency, and you saw all of the competition. You scoured the internet to see if somehow you could get an edge on them. The more you searched, the more confused and frustrated you got. Too many interview questions out there. How in the world do I prepare, you said. I'm so mixed up. Then you heard about this guy Socrates, who said that you need to know thyself. So you started thinking, and guess what? You began to figure out exactly who you really were, built on a lifetime of experiences you had in school, in pharmacy, at work, and at home. When you examined and searched your brain, a bounty of different situations and experiences that describe you flowed out. You took these characteristics and organized them, and before long, you put all of these qualities together. You soon developed a lot of stories to tell to describe yourself. You figured out what your strengths and weaknesses were. You described how you showed teamwork when your high school group won the state championship in marketing, and how you were so proud of being the team leader in your pharmacy school diabetes workshop. Your future goals became even clearer. Not only were your pharmacy goals much sharper, but your overall personal development was better defined. You sought out friends to help you with the interview. Soon you were able to put everything together in a package, and as the interview got closer, you became more confident of yourself. Then it was time for the interview. You felt that it wasn't easy, but it definitely was easier since you prepared the right way, and you got to know yourself better. And guess what? Everything worked out fine. You did it. You got the residency that you wanted. Hooray! All of your hard work paid off. Congratulations.
I hope you have found this video to be helpful. Good luck to you in finding the residency program that's just right for you.
We've got a lot in store at the PharmEZ Tutor channel. There will be upcoming talks on cardiac vasoactive drips, pharmacokinetic dosing, treatment of multi-drug resistant organisms, TPN, and much, much more. So please stay tuned to us. Thanks for tuning in to watch this episode of the PharmEZ Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube and to stay informed of when the latest material is available to you, please click on the subscribe button below. Check the description and comments section below for links to information related to pharmacy residencies, including lists of potential interview questions and more residency hints and tips. Stay tuned to the PharmEZ Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.